And welcome to our weekly COVID-19 press briefing. I'm joined by Paul Morrison, who is our Commissioner of Legislative Services and the Director of Bylaw Enforcement, and Dr. Lawrence Lowe, who of course is the Medical Officer Health in Peel Region. I want to start today by thanking the province of Ontario for this early entry into Step 3. I had advocated for that earlier reopening, given the indicators that are so positive right now in Peel Region and frankly across Ontario in terms of hospital capacity, positivity rate, and COVID case counts. And by and large, the progress we've seen is because of the sacrifice of our residents, your willingness to get vaccinated, to protect your friends, family, and community. Just this past weekend, I was at the Save Max Soccer Center, and we had thousands of people all night long lining up to get vaccinated. It was beautiful to see. I looked at that crowd and I said to myself, our community is being protected. And so the vaccines are doing what we expected them to do. They're getting us back to normal. And so this entry on Friday into Step 3 is a recognition that vaccines are protecting our community, and we're seeing decreasing COVID numbers because of that. This is very good news. There's numerous sectors of our economy that are going to be reopened. And just to share some of the details, what Step 3 means for our community: outdoor social gatherings up to 100 people, indoor social gatherings up to 25 people, indoor dining and restaurants will be back, of course, at 50% capacity. Our rec centers are going to be open again. Our rec centers have been closed for a long time. Indoor swimming pools, ice skating rinks, indoor basketball, soccer will be back. Kids sports essentially will be completely back. And so I'm very encouraged by that. It's good to see our community getting back to normal. I would note we're not out of the woods. There's still efforts underway. We need to get more people vaccinated if we want this to last. I hope this is the last lockdown we see in Ontario, and the best way to ensure that is to make sure that we have vaccination numbers that are the envy of the world, and we can have that in Canada. Right now, seeing vaccination numbers as of the last report, close to 80% first doses, over 50% second doses. Many countries would dream to have vaccination numbers that high, but we can do more, and the more of our population that gets vaccinated, the more we're going to be able to ensure that our healthcare capacity is never threatened again by COVID-19. And so if you have a friend, a relative, a neighbor who hasn't got vaccinated, please encourage them to do so to protect themselves and their family. We're also deploying rapid tests right now to enable industry to safely work and ensure that COVID is not moving around in the community. There's a Stay Safe program, which is supported by the provincial and federal government, which provides COVID-19 rapid tests to small businesses and industry in Ontario. And we've distributed 251 kits and 6,275 tests locally in Brampton, and I know we're grateful that those rapid tests are being deployed. For all the information on the current COVID regulations, I know it can be confusing. We had a color-coded framework, and now there's the 3-step framework. For any confusion, any question you have, just go to brampton.ca, and we have listed under our COVID website what the current provincial restrictions are. In terms of a hospital update, it's very encouraging. We currently only have 5 COVID-19 patients at Brampton Civic Hospital, including 1 patient in ICU. So just to put that in context, during the height of the third wave, we had more COVID patients at Brampton Civic than we did at the COVID-designated hospital in Vaughan. We were the busiest COVID hospital in Canada. We were transferring 100 patients a week at one point to other hospitals. We were so overburdened that we were depending on hospitals across the province to help deal with the volumes in Peel Region. So to think that we only have 1 patient in ICU really shows how the sacrifices have made a difference. And frankly, if you look at what's happening now with COVID case counts and hospitalization, this has become a pandemic of the unvaccinated. And so once again, vaccines work. Vaccines protect you. And just looking at the hospital, shines an example of that. And so very encouraging to see that our hospital capacity is in strong shape. And thank you to Dr. Naveed Mohammed and his team who really stepped up during this pandemic. Dr. Naveed Mohammed, who runs the Osler Health System, did a phenomenal job, and I think we owe a great debt of gratitude to the nurses, the physicians, the healthcare workers at Osler Health. It didn't come without consequences. We lost 2 Osler employees to COVID-19 during the pandemic, but they helped us weather an incredibly difficult year. So now that we look at the better days ahead, the sunny days ahead, I think our community should certainly be grateful for those that helped us handle the toughest year and a half that I think any of us could have imagined. On that note, it's my pleasure to ask Dr. Lawrence Lowe to join us for an update on the COVID picture in Peel Region, and I expect he's going to have some good news for the community.
Good morning, and thank you, Mayor Brown, for your leadership, and to all the community for the steps we've taken to control COVID-19. As we head towards Step 3 reopening this week, our test positivity is at 2.3% and our case rate sits at 13.8 cases per 100,000. These numbers are stable, as is our hospital picture, and as we move towards Step 3 reopening on Friday, I urge all residents to access 2 doses of vaccine as soon as possible to obtain protection against COVID-19. Nearly 11,000 residents did just that at our 40-hour dosing marathon at SafeMax on Saturday. From 7 a.m. till 11 p.m. on Sunday, 7 a.m. Saturday till 11 p.m. on Sunday, our clinic ran at full capacity, including the overnight hours that served so many residents who could not otherwise access their vaccine doses at other times of day. For the residents who have not yet received the protection of a first dose, I urge you to do so immediately. The vaccines are safe and effective, and even 1 dose protects against hospitalization and death. If you're uncertain, I ask you to reach out to friends and families who may have been vaccinated ahead of you to ask about their vaccine story and to obtain reassurance that you are making the right decision. If it has been 28 days since your first dose, I urge you to move your second dose date up today to fully protect against the Delta variant. We have tens of thousands of appointments available over the next 2 weeks, including walk-in appointments today at SafeMax Sports Center and at Paramount Fine Foods from 9 a.m. till 1 p.m. and also again from 5 p.m. till 9 p.m. So I'll say that again. Walk-in appointments are available today at SafeMax Sports Center and Paramount Fine Foods from 9 a.m. until 1 p.m. and from 5 p.m. until 9 p.m. I want to reiterate that mixing doses continues to be safe and effective. Moderna and Pfizer use the same mRNA technology, and both vaccines continue to be offered at our clinics in accordance with federal and provincial guidance and established vaccine science. Getting all residents to 2 doses of protection as quickly as possible is the best way to continue exiting the acute phase of the pandemic, and I ask that as you do so, you continue to treat our staff with respect. When the cold of fall returns, we will move indoors again, and in the context of increased reopening and contact, those who are not fully vaccinated will be at an increased risk of severe illness and outcomes with COVID-19, and also at risk of spreading COVID-19 in the fall. As has been seen elsewhere, any resurgence among the unvaccinated would threaten our lives and our hospital, and by extension, our community's reopening. That's why your decision to get vaccinated is so important. Getting 2 doses protects not only you and your loved ones, but our community's progress towards ending the acute phase of the pandemic. As we move towards Step 3, I'm grateful for so many that have made a difference here in the region of Peel together. I'm thankful for the leadership of our mayors, our councillors, and the collaboration of so many of our partners at province and locally, especially here in Brampton at William Osler Health Partners. I'm also grateful for the sacrifices of our residents and businesses, our providers and first responders, and frontline workers who have all gone out to work while keeping the rest of us at home and safe. I'm thankful, and I'm also inspired by the many residents who have already gotten vaccinated. Of note, bucking trends seen elsewhere, our 18 to 24-year-old residents in Peel have been incredibly enthusiastic, with 90% having received a first dose and nearly 50% having access to doses to date. That means for our eligible residents 12 plus, we are sitting at almost 79% first dose coverage and 54% second dose coverage on over 1.95 million doses delivered. These collective efforts are making a difference, and together we are continuing to save lives and keep everyone safe. But to finish this, we must all do our part. So please, as we move to step 3, continue to stay safe, stick to precautions where it makes sense, particularly indoors and in big groups, and continue to get your shots. Getting everyone in Peel to 2 shots of vaccine will make us one of the most protected communities in the world and allow us to move forward together with confidence. Thank you, and back to you, Mayor Brown.
Well, thank you, Dr. Lowe, and it's certainly encouraging to see so many young people in Peel Region sign up to get protected, to get their vaccine. That's a very impressive figure. It's now time for questions, and first up we have Chanel from CP24.
Hi guys, thanks for taking my question. Would first like to ask Dr. Lowe about some details on step 3. So like gyms and theaters, they're going to allow people to remove their masks at certain points. So if you're inside a gym, once you're at your station, you can take your mask off and work out. If you're inside a theater, you can take your mask off while you're watching the movie. Do you have any concerns about that? How convinced are you that that's going to be safe for people in these sort of big open settings?
Yeah, Chanel, I think we're now getting into the area where there are recommendations and there are regulations. And so, I think regardless of what the regulation says and what is permitted, we do know that COVID transmits more easily indoors. We do know as well that in crowded indoor spaces or even spaces where there may be distancing, that aerosolization may present a threat, particularly if someone is wholly or partially unvaccinated. So I think it is really vital, that our recommendation continues to be that if you are indoors, particularly with people whose vaccine status is unknown to you, that you consider, to the extent possible, maintaining distancing and continuing to wear your mask until such time that trends and data support that we have fully exited the acute phase of the pandemic. Thanks for the question.
Okay, and my next question, thank you, Dr. Lowe, is for both yourself and Mayor Brown, if I can get both of your takes on this. We heard from Dr. Kieran Brown with the province saying that a vaccine passport within Ontario is not being considered right now. Want to know whether Brampton businesses are going to be able to sort of enforce their own vaccine passports. Obviously, there are business owners that feel like they want to be safe. They want their employees and their customers to be safe. So what are the rules around this? Are they going to be allowed to do this? And do you have any concerns about, the constitutionality of a vaccine passport altogether?
So from a municipal perspective, that's not something we have jurisdiction over. We would have no bylaw enforcement or legislative authority to provide for a vaccine passport. That's a decision that would really have to be made at a federal level. But I will let Dr. Lowe speak to any advice he has on the topic. But it's certainly not something that we can enforce municipally or we would attempt to.
Yes, thanks, Chanel, for the question. Thanks, Mayor Brown. I think in respect to a vaccine passport, Mayor Brown has correctly identified that this would be a decision taken by higher orders of government, both at the federal level in respect of a vaccine passport as it pertains to border control, and then at the provincial level in respect of its application. Beyond this, the question as to whether private businesses can impose certain restrictions to entry, that becomes a legal question, and that's beyond my level of expertise. But as I understand it, private businesses do have the right to impose certain conditions of entry, and I believe that certainly a legal opinion may be what you seek in respect of that specific question. Thank you.
Our next question is Jeffrey Allen from Insaga.
This question is for Dr. Lowe. Dr. Lowe, Mayor Brown just called this a pandemic of the unvaccinated. do we have the vaccinated, non-vaccinated breakdown of those needing hospitalization at a local, provincial, national level?
Absolutely, Jeffrey. So since May, I understand that the provincial numbers have shown that over 83% of the people that have required hospitalization were individuals that are unvaccinated. I understand as well in Peel that we are finalizing some of our own numbers. I believe it's a similar percentage, even higher, above 90% people that ended up requiring hospitalizations or succumbing to COVID-19 were individuals that were either unvaccinated or partially vaccinated. Thanks for the question.
And once again for Dr. Lowe, we've seen numbers fall in places like the U.S. and the U.K. And now, over the last couple of weeks, these numbers are surging again. A report just came out yesterday that there was 23,000 cases in the U.S., double the previous week, obviously driven by the Lambda and Delta variants. What is going to prevent that from happening here over the next 4, 6, 8 weeks?
It's a great question, Jeff, and the answer is twofold. Actually, ultimately, the answer lies with all of us as a community. And first of all, ensuring that we are gradually reopening along with our society. Now is not the time to fill up your social calendar to excess. It's about coming out into the light, gradually and starting with small groups with people that are vaccinated. And the second piece is continue to drive forward vaccinations. A lot of the surge that you're seeing in both the UK and the US are amongst unvaccinated and partially vaccinated populations. There are some US states where coverage rates are well below even 40 or 50%, as I understand it, and as a result, you are now seeing that disease there. The other thing I would mention as well is, as I understand it, the US and UK experiences are not comparable. In the UK, while they are seeing cases go up, thanks to their high vaccine coverage rates, they're not necessarily seeing as severe a rise in hospitalizations. Don't get me wrong, there is still a crush that is occurring, but it's definitely not as severe as it was during the UK's third wave, whereas in the US, they're very much seeing that same cascade from cases into hospitalizations and mortality. And I think the last thing I would share to people is there have been a lot of people who have speculated that our current numbers in Peel and Canada, et cetera, are due to seasonality, that it's just summertime and this is, that the numbers are better. It's summertime in the UK and the US. It's summertime in the Netherlands right now, and the Netherlands has seen their cases rise from 800 to 8,000 in 2 weeks. So it's not seasons, folks. I think the reality is vaccines work, they're effective, and that's the best way that we can become one of the most protected communities here in the world to ensure that we don't see similar surges in hospitalizations and death. Thank you.
Thank you, Dr. Lowe, for so eloquently answering that question. Next question is Nikki Cedrone from the Bramptonist.
Hi, good morning. Dr. Lowe, there is talk about getting a booster shot. Do you know if or when we need one?
Thanks, Nikki. This is a topic of active discussion at the federal and international levels right now. We do know that other countries, such as the UK and US, are looking at booster shots specifically for higher risk and more vulnerable populations. In Canada at this time, Dr. Kieran Moore, at least in Ontario, has said that there's no indication that this is supported at the federal level. I think it's also worth noting at the international level, they're highlighting the challenges of equity of vaccine and the need to really protect all of us worldwide with the reality that a lot of countries have a lot of vaccine right now, and there are a lot of countries that have yet to see a drop of vaccine. And that was essentially that mix-up in the WHO, where a session on booster doses was trying to talk about, do we need to look at third doses in countries where you have robust protection after 2, when other countries that have yet to start vaccination programs. So lots of questions there, and I will defer to my federal counterparts for their decisions. Thank you.
Thank you. My next question is for both Mayor Brown and Dr. Lowe. Both of you have been open and accessible with Brampton citizens and have done a commendable job developing trust through this pandemic. But there are still people who are reluctant to vaccinate. What is left to convince the 20 to 30% of people who are slow to respond?
So for those remaining 20% in our community that haven't been vaccinated, in some cases, it's simply because they haven't had the time, and that's why we're trying to make sure there is no shortage of appointments. the overnight session at Save Max, we had some people in the trucking industry come in and say that they couldn't get a time because they're shift work. Convenience store owners, we had convenience store owners who were working 7 to 11 o'clock at night, and they came in at 2 in the morning because it was the only time that they were free. So we're going to continue to look at creative ways, creative opportunities to make sure that every segment within our community is vaccinated. But I'm not naive to think there isn't vaccine hesitancy. There is some vaccine hesitancy, and my advice would be listen to the physicians. Dr. Lowe has dedicated his life to understanding infectious diseases, to understanding the science, the data, the medicine behind keeping the public safe. And when our top physicians are emphatic that this is the best advice to protect you, this is the best approach to protect you, I would encourage residents to listen to that sound, educated medical advice. And from my personal perspective, I encourage everyone in my family to get vaccinated. My grandmother is 107, extremely vulnerable, in a long-term care setting where 43 people passed away in her long-term care home. I jumped at the opportunity when my grandmother, it was her turn to get vaccinated, and she's been safe ever since. In my own family, I encouraged everyone to get vaccinated, and you wouldn't be encouraging your own family to get vaccinated if you had any concerns that that wasn't the best choice. So for anyone watching, I would say listen to the medical advice. These vaccines are incredible products of science that are intentionally focused on protecting you from a virus that can be fatal.
Yeah, thank you, Mayor Brown, and I would echo what Mayor Brown identified, Nikki. It's for this reason that we will be starting to transition our mass vaccination program more and more into those community outreach and those creative means to reach people who otherwise haven't been able to come to the mass vaccination program. We know, we'll start engaging more with primary care. We'll start engaging more with community outreach. This weekend, for example, we have a trucking industry clinic set up. We have a Latin American clinic that is being set up. Our Black African and Caribbean clinic is coming back. And a lot of our current resources that are dedicated to mass vaccination will be targeted at reducing barriers. So that covers off the group that just hasn't been able to access due to barriers. We know that interchangeability has been a question for many. I would really take the opportunity to reiterate with everybody. Pfizer and Moderna are like Advil and Motrin. They're both the same active ingredient. They're just different formulations, different brand names, but your body doesn't see brands. It basically uses it the same way. So I think that's the best thing I can say on that front. And then for the last, for the people who are really hesitant and really just trying to understand what does this mean ultimately, I think the easiest way I'll say is the reason COVID-19 has cast such a specter on the world and on our community is because it is a novel virus. It is still as novel today for someone who has never been infected for it as it was in January 2020, even though we're all sick and tired of the pandemic. And if you have never been vaccinated, if you get COVID-19, you don't know how your immune system is going to react. It is basically spinning the roulette wheel. So it could be a mild cold, or you could end up in ICU with a tube down your throat. That will remain for anyone who is unvaccinated. Once your immune system is primed with the vaccine so that it knows what this virus looks like, then it's no longer novel to you. And that is the reason why we're saying 2 doses of vaccine. And for the record, on the topic of interchangeability, as well as some of the other decisions that have been taken through our vaccination campaign, I know a lot of people are hesitant to get their second dose because they've already got their first dose and they're waiting, they're holding out. The reality is with the Delta variant, it is still novel even for a partially vaccinated individual. So you need that second dose as quickly as possible. And many people had questions when we followed the science and evidence of vaccine science for decades and said we're going to extend the dose interval because we know that this can actually last beyond 28 days. Look at where that got us in Canada. Similarly, interchangeability, where we started supporting that in mid-May. Look at where we are in Peel now as part of the hotspot strategy. The fact is in the data, it's proven that interchangeability works, that the extended dose interval works, that the vaccines work. So please don't take a spin of the roulette wheel with COVID-19. Please get vaccinated so it's not a novel virus for you anymore. Thank you.
Thank you, Dr. Lowe. And our last question today is for Nitin Chopra from Prime Asia TV.
Thank you, Mayor. My question is to Dr. Lowe. Dr. Lowe, how true is it that many cases of side effects after first dose of Pfizer is observing, and hospitals are not reporting that? A young, healthy girl of 16 years got inflammation after her first dose of Pfizer, and she got inflammation in colon and was hospitalized for 2 weeks with low blood count, blood loss, diarrhea. And this is not a single case. Many other cases came to us too after first dose of Pfizer. So parents want to hear from you in this regard, those who are observing and suffering from this. Thank you.
So Nitin, it's important that any adverse event following an immunization get reported, but it's also important to draw the distinction that that adverse event may not have been caused by the vaccine, right? So anything that does occur needs to be reported so that public health authorities can look at the side effect. And that's why we've been able to look at, the blood clots following AstraZeneca, which were extremely rare, but we were able to identify that association through reports and then determining that, yes, there may be a causal linkage. But in this forum, just sort of mentioning something of this nature without having the opportunity to look at the case and do an investigation is unfortunately a bit irresponsible. It's not a case that I can comment on. And subsequently, it's also not a case, it's like saying someone had a vaccine and then they got hit by a bus afterwards. It is a bad thing that happened after the vaccine, but you have to look at it and say, is this reasonably caused by the vaccine? What are the details of the case? So in the absence of those details and in the absence of a formal report, I think it's I think it'd be irresponsible for me to comment, and I think it'd be important for those who have experienced that to at least report it to us so that we can look into it further. Thanks for the question.
Thank you. Follow-up is also for Dr. Lowe. Dr. Lowe, for the booster shots, earlier there was report published that we need a booster shot in 8 to 9 months, and report also said that federal government is in the process of procuring the booster shot from Pfizer. So many other countries, they already started the booster shot. How many booster shot one needs after second dose, 1, 2, or 3? And after how many months? And also, if someone refuses to get a booster shot, will they lose their immunity?
So thanks, Nitin. Like I mentioned, this is an active topic of discussion at the federal and international levels, and I look forward to seeing what they come up with. We're still looking at the overall data around the robustness of immunology and how long the protection lasts for. I know many people who are actually enrolled in serology studies where they're trying to see how long the immunity lasts. But at this point in time, there isn't a federal recommendation for booster shots in Canada, and elsewhere in the world, there's lots of discussions and potential programs that will be started, but I don't believe that there's actually been a country that has started doing booster shots, at least at this moment. Thanks for the question.
Well, that completes our questions for today. Thank you for tuning in to watch our COVID-19 update. Stay safe, stay healthy. Make sure if you're not vaccinated, you get vaccinated. And thank you to Dr. Lowe and his team, Paul Morrison at Bylaw, Dr. Naveed Mohammed at the hospital, all the frontline workers. We've done an incredible job combating COVID-19 in Peel Region. Let's keep it up.